You know how it's said that communication is key? Well, in a clinical environment, it isn't only key, it's life-saving. Communication between nurses and patients, between the nurses themselves, their management, and then communication between nurses and doctors and surgeons or the healthcare professionals treating their patients. It all plays a critical role in safe and effective healthcare. And yet very little attention is paid to priming communication skills in nursing school, which basically means that nurses are entering the clinical workspace without some pretty important tools. Well, this is a problem that Kathleen Bartholomew seeks to address as an internationally recognized patient safety and health culture expert. Kathleen, who is also a registered nurse, is passionate about teaching healthcare workers how to communicate and listen effectively, which breeds much better working environment. It's all in her book, The Dauntless Nurse, but today Kathleen is sharing her wisdom with us right here, right now. All right, Kathleen, you have educated and surveyed thousands of nurses. Why do you think there is such difficulty communicating effectively in the healthcare environment?
Well, what I found out was that I asked nurses if I could guarantee that the conversation would turn out okay, is there someone you would have a conversation with? And I was shocked that 99% of all nurses in all audiences said, yeah, if you gave me a guarantee, I would. And then I asked them why they weren't having that conversation. And it really surprised me to find out that it was because of fear. They were afraid of making the situation worse, afraid of being isolated from the group. A lot of them said, why bother? Nothing's going to change anyway. So I noticed that in the healthcare profession, especially in nursing, that there's a lot of what we call self-silencing.
Right. Okay, so how did you come to the realization that communication between nurses and their patients was so critical? Walk us through how it can serve both the nurse and the patient.
Well, I can't remember who said it, but somebody said communication is it's not about the relationship, it is the relationship. So when we're talking about communication, I really want to bring it down to, why is the relationship, first of all, with the nurse so important? It's because you have to have trust. There are so many things that you can't get in a pill or a surgery. I mean, sometimes our patients need hope. Sometimes they need somebody to talk to. And so the foundation of all of that is trust. And also they have information that the physician often needs, might have neglected. Oh, by the way, I was taking this medication at home. Or the nurse would discover that the patient's going to be discharged to an inappropriate setting. Through conversation, through her fact-finding, through her relationship, the patient shares more. And I can't tell you how many times that data has really been pivotal to managing the case.
And I sort of imagine that a part of that communication might be body language. A patient exhibiting some kind of symptom or something through body language, that if a nurse is good at listening, might pick up on that.
Right. And so before listening, it even has to be present. So I see that nurses are working harder and faster. And so it's very hard to race from one room to the next and be totally present to a patient. One trick or tip that I teach is every time you go through a doorway, you stop and take a deep breath. And that helps you to center so that you can be present with the patient and then listen to what they want to tell you, what the story they tell you.
Yeah. Okay, so how about communication between the nurses themselves and their management? How does that impact their ability to work effectively?
It actually impacts the entire team. So it's the manager's job to create an atmosphere where everyone is free to speak their truth. A manager's job to create the culture where if you don't agree with something, you don't hesitate to share it with the team. Where if you almost committed an error, if you almost made a mistake, the first thing you're going to do is share it with your team. I almost made this mistake. So what we learned about trust is that our grandmothers were right. One bad apple does spoil the whole bunch. And that you can't have trust in a team unless everybody pays attention, everybody has the same rules and does their fair share of the workload. Some managers can be laissez-faire, meaning, do whatever you want. Others can be more authoritarian and controlling. You'll do, check with me, very micromanaging. So the type of manager has been shown to determine the culture. So both times, like if you are too authoritarian or too loose, that has a tendency to create hostility in your team. What you need is just the right amount of, I trust you, I believe in you, I'm here for you, call me if you need anything, I've got your back.
Right, right. And do you find there to be politics between nurses at all?
Between the nurse and the manager, or between the nurses, each other?
The nurses, like sort of like a high school scenario where you get sort of, I don't know, potentially infighting or conflict?
Well, I wrote a book called Ending Nurse to Nurse Hostility, Why Nurses Eat Their Young and Each Other. And it was
That's awesome.
it's my pivotal book. It actually is in its second edition, and it's the only book recommended by the American Nurses Association in their section for nurses. It explains the etiology. So you mentioned high school. I mean, let's even do middle school. So when you have a clique, when you have behaviors like this, which women learned, all women learned, and healthcare is mostly women, when you have these behaviors, then you don't have a team.
Mm-hmm.
So a team is where you have trust and everybody has the same rules, and you can feel free to speak up to anybody about anything, and there are no cliques. The things that hurt our teams are like when somebody comes in late all the time, when somebody calls out sick and they're not sick, they went to a concert, you saw it on Facebook. When the manager plays favorites, when there are the differences that are allowed.
Yeah.
But this phenomena of hostility is because of the hierarchy. So when some people have more power than another, the group that doesn't have any power always lashes out against each other, and it's not conscious. For example, I've never met a nurse in my life who ever thought to herself, I think I'm going to roll my eyes now. And then when I'm done, I'm going to sigh and I'm going to ignore her. We don't think those things out loud because they're learned behaviors.
Right. Wow, that's scary that in a professional working environment you get sort of almost juvenile tactics like that.
They're survival tactics and they're learned behaviors because, when nursing started at its inception, there was such a power differential. I know nurses who still, are working that used to stand up and give a male physician, they were mostly male then, their seat, or make coffee and get donuts and run like subservient behaviors. But now our healthcare system is working towards collegiality.
Right.
And so how do you know if you have a collegial relationship with your peers, whether it's a physician or a nurse or your manager? You share a cup of coffee.
Yeah.
You share a cup of tea. You have a relationship where you can speak up.
Right. Well, on that subject, how does communication between nurses and doctors or surgeons affect the standards of healthcare?
Standards, it affects the outcomes. It affects the quality of care because the nurses have the information that physicians need. And sometimes if they've had a bad experience, they might hesitate to share that information. And that is a huge problem. It's the physician's job to create an atmosphere where before he leaves the floor or she leaves the floor, they would always say, excuse, is there anything else that you want to bring my attention to? Have I forgotten anything? Do you have any information for me? Do you have any updates? What do you recommend, etc.? But I used to have a physician who was really powerful, and the nurses would never talk to that physician. And then one time I decided to have a Christmas party, and the physicians and nurses came together. And what I noticed the next day was the quality of the outcomes. The patient care improved because nurses were no longer afraid to speak up. They had a better working relationship. They had a relationship, so their communication, just flowed.
Oh, that's great. Well, given the relative scarcity of the doctor's time, how might nurses communicate better with doctors, even if they are intimidated by them?
Even if they are. So using a tool. So there's lots of tools. You can look up SBAR or SBARD, some people say, situation, background, assessment, recommendation, and decision. So you want to be clear. You want to have the information. There's nothing that is more frustrating than when a nurse contacts a physician and she doesn't have the very basics, the vital signs, the previous vital signs, the chart in front of her, open and looking at it. Don't take the call unless you have that information. Don't call a physician unless you have that information. But also you have to think it through. So on our floor to new nurses, we would say, before you even call a physician, run it through the charge nurse. What's the situation? This patient is 3 days post-op. You've noticed decreased lung sounds on the left side. What's your recommendation? What do you want? I want a chest x-ray. Okay. So be clear and be concise. And, when we have computerized charting, I don't know that that's necessarily make communication better between physicians and nurses. I don't really see a lot of physicians looking at the nurse's notes. So I would advise, there's usually a section on computerized charting to put what you really want the doctor to know right into the chart. Or you could even say, please find me. I mean, I need to talk to you, or the critical things. We need to be on the same page.
Yeah. And I imagine once you get that right, a couple of times, that the trust between doctor and nurse will be at a point where if a nurse raises her hand or his hand and wants to speak to a doctor, that it will be taken seriously. Or at least I hope. Oh, you froze there for a second.
So did you.
Oh.
Right. That one over again.
I was just saying that I imagine that you reach a point in the relationship after the nurse has put him or herself out there a couple of times, that there will be trust between the doctor or surgeon and nurse, so that they're taken seriously.
Absolutely, but I also want to point out that the doctor has to put himself out there too.
Right, yes.
I mean, for a physician to put themselves out there requires for them to be vulnerable. Yes. So what you need to even this scale is for a physician to be more vulnerable and say things like, have I forgotten anything? I mean, I know a nurse I watched a nurse walk up and say, why did you order vancomycin on this patient? I don't understand. And the physician went, oh my gosh, I ordered it on the wrong patient. Thank you for pointing that out to me.
Yeah.
I mean, or the nurse who walked up and the doctor wrote an order for Lasix, and she goes, I don't feel safe giving that because you haven't checked the potassium level. Could we order a lab before I give that medication today?
Right.
I mean, so there's lots of situations. In fact, we had a situation on our floor where we called the doctor and he was not coherent, and he was the only doctor on call for that patient, and his response was not appropriate. I don't know what was going on. Perhaps he was sick, perhaps he had a bit of a breakdown, but we immediately called the medical director, who himself rushed over to the floor to take that place. So it's our job to escalate if we do not see that the patient is receiving the quality of care that our own family member, we would want our own family members to receive.
Right. Yeah. Okay. So what about improving communication with the patients themselves? What are some common mistakes nurses make, and how might they improve their approach?
I think the most common mistake is that nurses are not aware of their nonverbals. You mentioned that before. So when I'm in a hurry and when I'm concentrating, somebody told me that my face looks stern, and that was feedback I didn't know. So when I'm concentrating on the fact that the pharmacy hasn't brought up the drug that I need, and I only have 30 minutes left to give it, and I'm waiting for a call for a physician, and I'm listening to see if the patient is out of the bathroom in the next room, I'm not really present to the patient that's in that room. Okay. So I think that the best thing the nurse can say is not, I'm busy. That's the worst thing. It would be, I'm here for you. It's my goal to create a relationship with you during my shift so that you can say and ask anything. Please let me know if there's anything I've missed, if you have any questions. If I can't answer them right away, I'll be back with the answer. I mean, if you need me, don't hesitate to call, etc. Making yourself available. And also, I mean, there's a lot of research the amount of time that a nurse has spent in a patient's room. If a nurse sits down for 30 seconds and another nurse stands up for 2 minutes, the perception from the patient is that the nurse who sat down has spent more time with them, because you're stopped, so simply a hand on the bed, a hand on their hand, is reassuring. But the most important would be eye contact. We talked about presence before, truly being there. I mean, you're the anchor for that patient. You're the conduit. The patient will ask you information that they'll never ask the doctor.
Right.
When can I have sex again?
Very important to know.
One of the most common ones.
Oh my gosh, really? Oh, when can I drink again? When can
Right.
Can I drink on these meds? All right. So please tell us about your book, The Dauntless Nurse, and how it can really help nurses.
I think it's fundamental. You can't prepare for nursing if you don't prepare for the culture that you're walking into. The Dauntless Nurse was written because I put an ad in the Student Nurses Association bulletin to 60,000 nurses saying, tell me a story from your clinicals. And the nurses told me stories of being ignored, of a nurse walking up and picking up the assignment sheet and going, oh, or I have to work with a student today. Are you kidding? And so, I mean, if you don't know how to respond to these situations by saying, excuse me, I noticed that you rolled your eyes when you picked up the assignment sheet, or I heard you say that you were working with a student today. Would you rather I find someone else to work with?
Mm-hmm.
I mean, so our self-esteem and our voice, you talk about communication, self-esteem and voice, they're just the same thing. They're synonyms. And so is power. So if you want to stay in your power and stay in your self-esteem, you will know how to respond to the situations that basically just chip it away. And most of those situations are nonverbal. So this book gives you it's filled with stories. It's short. It's filled with stories. Nothing's made up of that the students have. And then we teach them three tools on how you can respond. Right. You can memorize a response. You can use this DESE communication tool, or Control-Alt-Delete. And nurses have told us it's critical. The truth is that we trialed this book. I lived on an island when I wrote the book. And so I trialed it with critical care flight nurses. And when they gave us the book back, the only comment was, please take the word student out, because everybody needs to read this.
Wow, yeah.
We're critical care flight nurses, and we don't always say what's on our mind. We think, why did you not put that medication back in the bag? Or how come it took you so long to get the oxygen out? But we don't actually have that conversation. We just go back to the break room and then say, can you imagine how long it took her to see that we needed O2? So there is no skill that you need more than the ability to communicate, because you're actually communicating who you are, and you're communicating for your patient, and you're standing in your power.
Right. And do you think doctors could benefit from reading this too?
I think everybody could benefit, especially the patients. But this book is particularly for student nurses and nurses. I mean, even experienced nurses. And it's been used when it's used in orientation for a hospital, and when you teach the communication models, and when you set the expectations. That's what's so important about the book, is that this is what you should expect, and this is what you should not expect. And so when you walk into any job, no matter what profession you choose, and you have a clear idea of what's acceptable and what's not acceptable, you don't lose a little bit of yourself each day.
Yeah.
You know what I mean?
Wow. And I mean, on top of all the pressure that is inherent to the healthcare environment, you don't want to be having these kinds of issues with patients, with doctors, with your fellow nurses and management, on top of that stress.
Right. So, I mean, and then finding the time to connect with the patients. I wanted to tell you a story and I forgot about it. Kathy Torpy was in a head-on collision. She's in Australia. She basically broke her face so badly, and all the bones in her face, that she needed 16 surgeries to put her back, and she never looked the same because there were so many comminuted fractures. And then she wanted to tell her story as a patient. And I'll never forget one of the things she said. She said, I've had 16 surgeries, and one day a surgeon sat down on my bed and he looked into my eyes and he touched a place no scalpel could ever reach. And I think if you don't have that level of connection with your patient, if we let time or hostility or, pressures rob us of that, then we actually lose our profession.
Yeah. And as a recent patient, I had a plate removed from my wrist recently, so a very minor procedure, but I went in there terrified. So I can only imagine if you're actually really sick or really injured, the degree of terror that you feel going into the hospital. To have that moment of warmth and connection from another human being just makes all of the difference.
I went in for surgery, and I mean, they were great with asking my name and my date of birth, but they did it in such a way that I just felt like a widget on a factory line, by the time the sixth person came in and said, and you are, and she holds up my wristband, and I looked into her eyes and I said, 95253. And she went, oh, and she walked away, because I was just the number, and I was just the name of the surgery. That's what I was. As long as she had the number, I wasn't Kathleen. So, I think a challenge for every nurse is to preserve the time with our patients, to preserve time for ourselves, to preserve our relationships with our physician colleagues. Suicide rates are high. Depression is twice in nursing what it is of the regular population. So basically all this says is we need each other. We need strong teams. And how you build those strong teams is by creating an environment where everybody can speak their truth.
Right. Perfect. Well, thank you, Kathleen, so much for speaking to me today. This is such crucial advice. I mean, it always has been, but especially now, given the last year and a half of trauma that we've collectively gone through.
We're all stressed.
Yeah. Thank you so much. Really appreciate your time.
Thanks for inviting me.
Great. Well, there you have it. The best advice on effective communication in the healthcare environment, straight from the expert Kathleen Bartholomew, who not only wrote the book on this subject, quite literally, but who delivered a truly inspiring TEDx talk about it too, which I encourage you to check out. Details below. If you are studying to become a registered nurse or nurse practitioner, make sure you get Brainscape's NCLEX or nursing flashcards, which will help you study so much more efficiently and keep up that healthy cadence of daily review that is so essential for doing well in these content-heavy subjects. For even more guidance, check out the other videos we have on Brainscape's nursing channel and go to the Academy for A to Z study guides on how to excel in nursing school and beyond. These tools, together with your ambition and hard work, is everything you need to rise to your challenge.